We are a society that likes to work up a sweat, and in our constant pursuit of wellness, our bodies can sometimes break down. One of the most common areas where injuries flare is the foot and ankle, considered by doctors to be the foundation of the body. Whether we're pushing our bodies to the limit by competing in a marathon or by maintaining steady pace as you age, the physical activity that is so important in maintaining health sometimes puts the bones and joints at risk.
Some of the more common things athletes present with include arthritis, joint pain of the foot, ankle, knee, hip, or back, plantar fasciitis, tendonitis, overuse injuries, basically. It's important to look at your mechanics early on so that you don't let mechanical or alignment issues cause long-term wear and tear problems. Arthritis that develops because we have alignment issues a lot of the times can be prevented with some simple things done in the office.
Dr. Maurer feels proper biomechanics are necessary for long-term, pain-free movement. A biomechanical exam can alert the athlete to potential issues, and in many cases, a simple change can alter that patient's ability to stay active.
Biomechanics is the study of the mechanics of a living body, how your bones, joints, tendons, ligaments, and muscles move us through space. Knowing your biomechanics is important. Proper biomechanics are important for long-term, pain-free movement. Look at your feet, your hips, your knees, your back. Look at it all as it relates to how you've lived life so far. Look at your medical history. Look at your athletic history. Look at your mindset. All of these things contribute to what your risk for injury is, and I think it'd be great to come up with a plan that balances the risk of injury with the benefits of weight-bearing activity.
Located in Kirkland, Washington Foot and Ankle Sports Medicine Clinic specializes in the diagnosis and treatment of exercise-induced lower extremity pain. Dr. Maurer and his staff use state-of-the-art tools and techniques to keep their athletes running strong.
Our mission is to keep athletes moving. We do that through conservative and surgical foot and ankle care, through a comprehensive look at their mechanics to incorporate the evaluation of the knee, the hip, and the back. And we use all of this and a thorough history to give advice so that people can keep moving pain-free as long as possible. And I think that's important not only for your health, but more importantly for your happiness.
Practicing with an emphasis on the analysis of biomechanics, Washington Foot and Ankle Sports Medicine offers treatment for ankle pain, ankle sprains, Achilles pain, heel pain, pediatric disorders, ingrown toenails, shin splints, arthritis, and much more. We take pride in offering state-of-the-art technology in the treatment plans for our patients. One of the things we have is an AlterG treadmill. It's an amazing treadmill developed by NASA that helps lift the patient off the deck. So a patient can run with as little as 20% of their body weight. We use it after surgery to rehab to help remodel scar tissue. We use it for overweight patients and for long-distance runners, especially if they're hurt and they're trying to continue training for a marathon. We're excited to help develop a new technology called the Freedom Leg. It's a brace that helps us offload the lower extremity. It really works to offload feet, ankles, and knees. So for patients who have surgery, who have broken things, we can keep them walking without crutches, and it really helps mobility, helps people recover faster. I started to get interested in leg length when I saw a lot of asymmetry in the feet, and the feet compensate for different leg lengths. I was worried that if I changed the shape of the foot, that I would develop a compensation somewhere else in the body and maybe cause back pain. And through this interest, we've developed with the radiologists technique for evaluating leg length differences that's really made a huge difference. So we can help people not only with their foot pain, but it's amazing how much back pain, hip pain, and knee pain we help with as well. Video gait analysis is something we use to help evaluate the patient. It helps us understand how the foot, the ankle, the knee, hip, and back all work together. It also helps us in a big way in that it educates the patient. They can see how their mechanics work, and it includes them in the treatment process and really makes them an active participant.
I started receiving treatment for my flat feet in about middle school. Since then, I competed on the varsity sports in high school for track and soccer. Went on to play in college on scholarship for track and soccer as well. Now about a year after college, still doing great, walking around pain-free, still wearing my orthotics on a daily basis. I would absolutely recommend Dr. Maurer to other patients with foot issues or ankle issues. He's great to work with, very understanding, open schedule. Everyone here in the clinic is very helpful, very friendly, all times. He's recommended multiple different treatment options that have helped me tremendously.
Well, Dr. Maurer diagnosed me with extreme pronation and leg length discrepancy, which was what I had been told before, in fact, since I was a kid. And he put me into some much more aggressive orthotics, and I noticed almost an immediate difference. I could run without the Achilles tendon pain that I used to get. I didn't really have any throbbing or pain after running. It didn't build up, and I was back to normal. I was able to run as much as I wanted, which was really what I wanted to do. As far as recommending Dr. Maurer, I guess the one thing I'd say is that he's seeing the second generation of my family. My daughter's wearing a set of his orthotics out in Utah, and she's an avid runner and just did a 100-mile bike ride, so she's very active, and she's doing very well as well.
And it's all very gratifying when you put somebody back on their feet and you see them later and they've enjoyed the benefits of the movement that you've helped them with.
It's nice knowing that I don't have to look back and think, boy, I used to enjoy doing that. I wish I could do it today, because I'm still doing the things that I enjoyed doing 20 years ago and 30 years ago.
I think as boomers age, we're going to see more joint problems. We're going to see more joint replacements. We're going to see more degenerative arthritis. And the more we can get ahead of things by educating people and by having these evaluations done and taking this approach, the better off everybody's going to be and the happier. Anyone having pain in their feet, their knees, their hips, or their back that increases with standing, walking, or running is most likely biomechanically related. They should have their mechanics looked at. That's where the exam should start. That's where the search should start, and they should try and minimize that pain.
If you're an active person, simple changes in mechanics can minimize the risk of wear and tear injuries. Contact Washington Foot and Ankle Sports Medicine for a consult today and take a giant step toward long-term, pain-free health and happiness. For more information, go to rundoctor.com or call the number on your screen.